President Trump has endorsed a House budget plan that would make sweeping cuts to Medicaid. Under the proposed budget bill, roughly $880 billion would be cut from Medicaid, and $230 billion would be cut from the Supplemental Nutrition Assistance Program known as food stamps. The president's endorsement on social media came just hours after he said he would not touch funding for programs like Medicaid, which provides health insurance for Americans with limited income. Dr. Celine Gounder joins us now. She's a CBS News medical contributor and editor-at-large for public health at KFF Health News. So, doctor, what more can you tell us about who Medicaid serves?
So Medicaid covers people who are low income, so low-income households. It also covers pregnant women, children, and people with disabilities. And about 1 in 5 Americans are covered by Medicaid. So it really does account for a huge proportion of health insurance coverage. And to go even further, almost half of kids are on Medicaid. About 40% of all pregnancies are covered by Medicaid. So it's a really important program for women and children.
Quite startling statistics there. What would be the overall effect if these cuts were to happen?
Well, we're talking about huge cuts, right? Over $1 trillion over 10 years, over $800 billion from Medicaid. There are a few different ways in which this could play out. So one is that you could see the federal match for Medicaid go down. So what proportion of the total cost? Right now, it's about 80%. That's 70%, that's covered by the federal government. The states account for about another 30%. But let's say the federal government gives less, you're not going to be able to cover as many people. One of the concerns is Medicaid expansion, which added about 20 million Americans, low-income Americans, to the Medicaid rolls. That may have to be rolled back in some states because they can't afford to continue with that. Another proposal has been work requirements. And by the way, most of those low-income people who are added through Medicaid expansion, they actually do work. It's people like who work at Walmart and so on who do not get health insurance through their jobs, who are basically being covered by Medicaid. So work requirements are another way that they are looking at trying to get people off of Medicaid. And then finally, block grants, where you cap the amount of money the federal government gives, regardless of how many people might need or want to be on Medicaid, and really tighten up the budget that way.
Before we let you go, you and I have spoken before, really at the end of President Biden's term, about this proposal from his administration for Medicaid and Medicare and insurers to help pay for these weight loss drugs. And now it looks like the Trump administration is going to be pulling away from that. What do we know and what are the pros and cons?
So toward the end of the Biden administration, there was a proposal made by Centers for Medicare and Medicaid. So those are, the two big government insurance programs in the country. Medicare covers people who are over 65 and some people also with disabilities. And they proposed redefining obesity as an illness that in and of itself, whether or not you have diabetes along with it or cardiovascular disease, that just having obesity was enough reason to
qualify.
Right, exactly, to qualify for these medications. Now, these are very expensive medications.
Yes. $1,000 a month?
Yeah, $1,000 a month, over $10,000 a year. And so if you're talking about covering everybody on Medicare and potentially also Medicaid who fits that criteria, you're talking about a huge cost to the federal government. Now, there are pros and cons, right? So could you be saving lives? Could you be saving healthcare costs by doing that?
In the long run?
In the long run, we're not completely sure about that. The jury's still out on that. But the Trump administration is now saying they will pull back on that promise to expand coverage.
Okay, Dr. Celine Gounder, thank you.